Hi, my name is Alga Ramos. Welcome to Galliori Trips. As promised in the last video, today we're going to go into everything I have in my pink fanny pack for medical mission trips. This is super duper extraordinarily helpful as I'm going on trips, given that we do a lot of off-site clinic or remote clinics, so I can have a lot of handy dandy things and then move it to the side, move it to the front whenever I need it. And as you can tell, I just got out of work, and yes, I am standing on a sofa, but very professionally. Now, besides using a fanny pack, you can use whatever you need to have things accessible. You can use a sling like this one, but who are we kidding? The fanny pack looks way better. Now we're going to go through everything that I have in my pink fanny pack for medical mission trips. As you can see, I have two zippers here, one in the front, one in the middle. You can tell that this is worn, so I use it in real life. This is genuine. So here in the front pocket, you can already tell I have sticky notes. I really am a sticky note fiend. I love having this just to make, pharmaceutical calculations when I need them, or if I need to write down something in particular for a patient. I have another one here actually with somebody's email that I need to send them some information back. So double set of sticky notes. I have a red pen in case I need to annotate anything in particular. And then I even have a Wi-Fi code here for one of the places that we stayed at. So there you go. Helpful. And then I also have band-aids just in case somebody asked for them. And this last trip actually, somebody did ask for not sticky notes, for band-aids, so it did come in handy. We're going to go into the middle zipper now. So as you can tell, there's multiple things here. So I'm going to go one by one. Perfect. The first thing, which really isn't necessary, but I have some earrings and maybe a necklace just to have while I'm on the trip. Not necessary. Not that people need to be religious, but I do have my cross there, keeping me safe as I'm going. I have outdated business cards, really not needed, but I still have them there, very outdated. I also have my vaccine card. COVID vaccines, they're still asking for that as you're going into different countries or crossing different borders, so it's important to keep that with you when you're traveling. I also have some cash. I have a $10 bill here. Something that I didn't mention in the last video, but you need a crisp bill. So no tears, no rips, nothing written on the bill. So it needs to be pristine in order for you to be able to exchange it. I also have some meds, like for example, Dramamine in case I get dizzy, somebody gets seasick on the way over, I'm able to help them. I also have wet wipes. Wet wipes are incredibly important. You may need to go to many different restrooms. They may not always have paper available, so it's important for you to bring it with you or bring wet wipes. I also really use this when we had the remote clinics because oftentimes I would be cutting tablets, and then there would be a lot of powder on the counter, so I would clean that up to make sure, for example, I don't have a penicillin allergic patient and then they get a little bit of the remnants from the penicillin I had to cut or the amoxicillin I had to cut. So I like having wet wipes available for that reason. I also have here, which is really due to helping out with some of the administrative notes from a previous trip, and you see my name, Alga, just notes on the menu for one of the prior trips. So I always keep that handy because I don't know when they're gonna ask me menu questions and it may be helpful. We have really amazing people that help feed us during the trip, so it's incredibly helpful. I also have a list here, packing for remote clinic, and we can certainly do other videos, but you see here, remind doctors to bring their stethoscope and a bunch of other things from the formulary that is very important to bring. So that's there. And speaking of formulary, I always have a list of the medications that we have with our trip. As I mentioned before, I go with CHHF, so Carolina Honduras Health Foundation, but you see here that I kind of have some drugs highlighted that I want to remember, or maybe I want to look up the dosing just to be ready for action. So I always have that in my fanny pack. I also have here, this is live and in person, I have some earrings that I bought for my mom. That's for my mommy. I have actually some sticky notes. I mentioned that I really love sticky notes, and these are really some cheat sheets for calculations. Like here, acetaminophen dosing, amoxil dosing. What else do I have here? Dexamethasone for pediatric patients. I have here, oh, in my last trip, I had to make magic mouthwash, which, fun fact, if anybody asks you what's in magic mouthwash, that's kind of like a trick question because there's many different recipes out there, but I had to make one for like a 1-year-old. So I just have my notes for next time that I go, so I remember the recipe that I used. And again, here it's just dosing for augmentin, just so I remember how to do it for pediatrics. Oh no, now I need this in order. Just so I remember how to do it next time that I go. We actually do see, on the trips that I go to Honduras, we see a lot of pediatric patients. So being ready with your pharmaceutical calculations is imperative to make sure that patients get the right dose. And then the fun part, I have so many pens and so many markers. I promise all of these are necessary, but I really do. I have people oftentimes coming. People always go to the pharmacy to ask for anything. So I tend to be ready. I have Sharpies in case I need to mark anything. Like, for example, in particular, if I have a family, which oftentimes happen where they need to take oral solution antibiotics, I will mark in the syringes or in the cups how much the pediatric patient needs to take. So Sharpies are incredibly important. This is also really good to mark down your water bottle as well. If you have a plastic one, then it's good to write your name on it. And then of course I have a bunch of different pens. I also like different colors just because sometimes I might be writing something down, or for example, when you see this formulary list, sometimes it can also be the paper order from providers and they'll write, oh, I want this, I want that. If I make any changes or I update anything, I'll write it in red just so that it is highlighted when we're looking through the records. And last but not least, I actually have, when I'm on the road, I like to take some antibiotics or some medications that may be needed. In this case, you know, this is a friendly reminder for me to remember to ask what the formulary is at places. You'll see that this is actually ceftriaxone, but it has Flagyl written on it. It's actually a really funny story. So the first time that I actually went on a mission trip, you know, I'm happy, I'm there, I'm trying to help. We had an emergency where we had patient with intractable nausea, vomiting. We were thinking, oh, maybe it's like an intra-abdominal infection, something's going on. I remember asking, like, well, we don't have IV Flagyl. Like, what do you mean we don't have that? So the lead pharmacist, who I respect greatly, and he's just a phenomenal human being, I admire him so much, he mentioned, like, no, because the scope of our clinic is primary care, but here, you can have your Flagyl. So basically, you know, it's just good reminder for humility. Whenever you go to a mission trip, remember to ask what the core scope is for the clinics as well as the formulary, so that you're familiar with the medications that you will have on hand and what will not be available. And that's it. That's everything that I keep in my pink fanny pack. I think that it's super helpful. As I go on the road on remote clinics, sometimes I do try to have additional medications. Like I will bring like some lidocaine with epinephrine, or I'll have some syringes and some syringes and needles in my fanny pack as well, just because you never know what's going to happen. So it's just good to have a little bit of everything. And then if I need my ID with me or any other information, I like to keep it close to me. So the fanny pack really helps. And that's everything. And that has been everything that I carry in my pink fanny pack on my medical mission trips. So certainly, I hope that this has been helpful. As you can tell, there's a lot of different things that you can and should bring. Don't forget the wet wipes. Please feel free to like if this video has been helpful. Subscribe if you're interested in more medical mission trip videos. And last but not least, add comments in the bottom if you want to tell us what you would bring on your fanny pack, or if you have any other suggestions at all or questions about medical mission trips. And with that, I'll leave you guys. Thank you so much and have a wonderful rest of your day. Bye.